share the impactful story of the Sai Jagruti program, which focuses on mother and child care, including adolescent girls. Dr. Sandhya Nair.
Offering my most humble and prayerful salutations at the lotus feet of our dearest and most loving Swami. Pranams at the revered feet of his mother, Mother Ishwarama. My dear parents, my gurus, respected elders, dear brothers, sisters, and children. At the outset, I would like to thank Swami and all those who are instrumental in giving me this opportunity to stand before you to speak on a topic which is so dear to our beloved Bhagwan, the mother and child care, and also the adolescent health care through the Sai Jagruti initiative. How do I change it, please? Swami urged mothers to foster right living, harmony at home, and selfless love. He said that mother's womb is the birthplace of one and all, whether it is a commoner or the avatar himself. So, the mother's womb should be filled with good thoughts, good words, and good deeds. Only then can she bear virtuous children. What is the need for this program? The need for this program, actually, it is running very well in most of the states of India, but needs to be initiated in some of them. So, the need of this program is to create awareness and a sense of responsibility towards the needs and requirements of a woman while she is pregnant and during and after delivery. First, this has to be instilled in the woman herself and then in the family members, especially her husband, so that they are sensitive to her needs and take quick and timely action in times of emergency situations. A healthy society begins with healthy mothers and children. Good and skilled maternal care will help reduce the maternal mortality and the infant mortality rate, which are critical public health indicators reflecting the health and well-being of a population. The maternal mortality, that is the death of a mother during pregnancy or associated causes, it is expressed as maternal mortality ratio, that is the number of maternal deaths per 1 lakh live births. This is good news that there has been a decline of the maternal mortality rate in India, and also the global mortality rate has decreased. As we can see in the graph, the maternal mortality in 97-98 of India was 398, which has now come down to 93 per 1 lakh live births. This is attributed to the improved access to quality health through improved medical interventions, advancements, and the key factors being increased skilled birth attendance, enhanced antenatal and postnatal care, and broader immunization coverage. The causes of maternal mortality, as we all know, is hemorrhage, infection, and hypertension. These contribute to around 75% of all maternal deaths. There are post-delivery complications also, the warning signs of which we as Sai doctors have to train our Sevadal so that they go and they go and give the information, they educate the women in the villages of our adopted villages, and so that this contributes to reduction in maternal mortality. Most of the maternal deaths, almost 80% of the maternal deaths are preventable. It is vital to prevent unintended pregnancies, and all women, they need access to high quality healthcare during pregnancy, during delivery, and after childbirth. This can be done only by institutional deliveries. The births can be attended by skilled health professionals, and so timely treatment and management can save lives of the mother and the baby. For example, if there is hemorrhage, severe hemorrhage can even kill a healthy woman. By injecting oxytocin immediately after childbirth, this risk can be prevented. Then infections can be eliminated by good hygiene practices and early recognition and treatment of infection. Preeclampsia can be detected early in pregnancy and can be managed appropriately. Magnesium sulfate therapy will prevent convulsions that preeclampsia developing into eclampsia can be prevented. Then there are certain long-term medical complications also, which can be prevented by good health care to the pregnant women. The women in the remote areas are the least, they get the least chance of going to the healthcare center. They are the most neglected. And so Swami wants us to go to the villages and take care of these women and help them with a normal pregnancy and normal confinement. The various technological advancements and interventions are there by the government and many other bodies, which contribute to the help of these, it facilitates these patients. We as Sai's doctors have to train our the Sevadal, and in the adopted villages in collaboration with the Anganwadi worker, we should approach the pregnant women and their families and inform, educate, motivate, and counsel them towards the regular antenatal visits, hygienic practices, balanced, nutritious diet, physical activities, including prenatal exercises, yoga, the importance of daily prayers, and family planning measures. Then infant mortality is the next critical indicator which has to be taken care of. The various danger signs are to be told to the mothers and the family members. The various interventions and schemes are to be told to them. But in the action plan for the care of the child, it should be focused on improving the health care of the women in the first place, ensuring safe delivery practices, providing essential care to the newborn immediately after birth, and providing specialized care for the newborn. The adolescent health care focuses on the all-round development of the adolescents, that is individuals between 10 to 19 years of age. The physical, social, mental, and spiritual health has to be taken care of. There is this Rashtra Kishore Swasthya Karikram, which is a national program taking care of all the adolescents. There is an initiative called Adolescent Health and Wellness Day, which is an initiative of the Rashtriya Kishore Swasthya Karikram. Then the Sri Sathya Sai Jagruti initiative is of Odisha. It was launched in 2024, and it aims at the holistic development of adolescent girls. It is an awareness initiative focusing on building self-confidence, helping the girls realize their inner divinity, leading a purposeful life. The action plan for the adolescent healthcare can include counseling and education sessions. Health checkups can be arranged for them. Then we can reach out to adolescents in school, youth clubs, communities, etc. Games can be arranged, and peer education has great importance. And a question box and discussion can be arranged, providing them a platform to ask questions, and their queries can be cleared. The Sathya Sai Jagruti initiative, some pictures are there. Then the mother and child care is being done in various states of our country. Telangana is doing very good work, Karnataka North, Andhra Pradesh, Maharashtra, Madhya Pradesh, Odisha, Kerala, etc. The key components of antenatal care, which the WHO has given, I put it as a take-home message, because to prevent mortality and to have healthy women and healthy children, the women should have at least 4 antenatal visits, then the maternal assessment, fetal assessment, screening tests, counseling and education on healthy eating and etc. Then preventive measures like iron tablets and folic acid tablets and injection tetanus toxoid, etc. has to be taken care of. Then additional considerations like USG ultrasound, which will pick up there is placenta previa or conditions like that, which will prevent for us to prevent the complications. Nutritional supplement, etc. Finally, I would like to pray at the lotus feet of our beloved Bhagwan to give us the opportunity, strength, and dedication to perform this activity in all the districts of all our states, so that we can do our little bit to save the life of mother and child and offer this service as a token of our love and affection at his lotus feet on his 100th birthday. Jai Sai Ram.